think I chose orthopedic surgery for a couple of different reasons. Number one, I was an athlete growing up. I always played sports. I really enjoyed it, and that attracted me to orthopedics initially. Number two, I enjoyed the engineering sciences also. Again, I really wanted to build bridges, and this was one way that I could use my hands and use the mechanical aspects of orthopedics to really do something good for people. It wasn't until my third year that I really decided I wanted to do spine surgery. And I think it was the best thing for me because I really do get to use my hands and use my mechanical abilities to be able to do what I do. The way I would explain scoliosis is everyone's familiar with a normal spine. It's straight up and down. Scoliosis is an abnormal curvature. There's also a rotational part of it. So not only do you have this C shape, but you also have some twisting of the spine inside the body. And as such, that also contributes to what people see as the spinal deformity. What I always like to tell patients is that I trained in New York City, and they're not doing anything differently in New York City that I can't do right here in their backyard. They can have access to me 24 hours a day. They get me as the attending and one of my partners to take very good care of them and to give them more than what they would get in the city. I think the way that I stand out a little bit is, again, that I am the person taking care of you. I try to spend more time in the office. I try to answer as many questions as you have. I don't rush people out the door. If you do have an operation, I'm the one that's there that's doing it. I'm the one that's taking care of you in the hospital afterwards. I'm the one that you're seeing in the office for follow-up. I'm really here to provide a service, and that is good quality patient care. There was a time in my career that really confirmed to me that this is what I'm supposed to be doing. It was when the 12-year-old girl that I was taking care of, she was there to have her scoliosis corrected. She wanted to take a selfie with me and the operative team just before her surgery. So literally we're all dressed in hats and masks, and we crowded around the gurney, and she took a picture of us all together. And it was the first day post-op. She put that on Facebook, and she said, "I feel great. I'm so glad that I did this." And that to me was a very special moment. I like to think of minimally invasive as a way to accomplish what the gold standard is through a less invasive technique. In the end, what it should translate into is quicker recovery for the patient with a very similar outcome to what the gold standard is. My greatest hope for my patients is that they come back to the office and they say to me, "Thank you. You've really made a difference in our lives."